there will be a surprise outbreak. Given, as you heard from the introduction, that I have been around for a while and have had the opportunity and the privilege and the pleasure of serving in 5 administrations, I thought I would bring that perspective to the topic today, is the issue of pandemic preparedness. And if there's one message that I want to leave with you today, based on my experience, and you'll see that in a moment, is that there is no question that there will be a challenge to the coming administration in the arena of infectious diseases, both chronic infectious diseases in the sense of already ongoing disease, and we have certainly a large burden of that, but also there will be a surprise outbreak. And I hope by the end of my relatively short presentation, you will understand why history, the history of the last 32 years that I've been the director of NIAID, will tell the next administration that there's no doubt in anyone's mind that they will be faced with the challenges that their predecessors were faced with. So for those who think that infectious diseases is gone, there's so many people who've made foolhardy statements not knowing at the time that they made them. I usually show a quote from an old Surgeon General or an old pundit in infectious disease. So I thought I'd pull this one out from Sir Macfarlane Burnet, who was actually a Nobel Prize winning immunologist, who made the statement, as many did, to write about infectious diseases is almost to write of something that has passed into history. The most likely forecast about the future of infectious diseases is that it will be very dull, which is really kind of interesting coming from a semi-genius like Macfarlane Burnet. And I think what he did, and the mistake that so many people have made, is something that several of our panelists have already referred to. And that is a failure to look beyond our own borders in the issue of the globality of health issues. Not only things that are there that will come here, but surprises that we have. What are the lessons that we learned from HIV? One, you have to commit substantial financial and human resources. These things don't get addressed spontaneously by themselves. You have to enlist the best and the brightest investigators in both basic and clinical research. You have to involve the community, be it the gay community in the United States, or the community in Africa and West Africa when we dealt with Ebola, or the people in South America when we're dealing with Zika. You have to have cross-sector collaboration. You can't do it alone. The CDC can't do it alone. The NIH can't do it alone. You do it with all of us, with industry, with global organizations, with philanthropy and NGOs, and you gotta get the leaders and the policymakers involved. What is for sure, that no matter what, history has told us definitively that it will happen, because infectious diseases, as I said 8 years ago in this article with David Morans and Greg Folkers, that it is a perpetual challenge. It is not going to go away. So the thing we're extraordinarily confident about is that we are going to see this in the next few years. Thank you.